Joining us now, David Saunders. David, great guy. David is the founder of Madison and Maine. That's an advertising agency in Virginia, and he's also spearheading the new COVIDWise app in Virginia. And David, we wanted to have you on today to kind of bring us an update and explain what it is and how it works. And thanks for being with us, David.
Hey, John, I appreciate you having me on. I really do.
What's COVIDWise? What is the app? What does it do?
You know, it's important, and I appreciate you having the opportunity, giving me the opportunity to explain what it is and what it is not. Mm-hmm. When the technology component of contact tracing was first developed, I mean, back in March and April, and nobody knew exactly what was going on with the disease. Part of the thing is through contact tracing, it was important to let people know. What 40% of folks that have COVID have no symptoms whatsoever, so you could walk right by someone and or be in close proximity to them and be infected. And so early attempts at this, Utah put out an app, and it tracked your location, and it required you put in a bunch of data and all that. And guess what? It was a giant flop, all right? Because nobody wants to give their data over to the government. Nobody wants to be tracked. In a state of 3 million people, 400 downloaded the app, man. That was a flop, right? So Google and Apple, the tech giants who normally don't work together on anything, got together and said, you know what? Androids and iPhones both have Bluetooth low energy, right? It's a beacon. The same way that you put your headphones on 2 feet from your phone and you can hear your music. Right. Using this technology, which has been around since I've been at college, and that was a long time ago, John, we basically, they put together this framework so people could develop an app. Virginia was the first state to do it because it doesn't track you, it protects your privacy, it doesn't require any personal data, but the phones basically act like beacons. So if you and I were at a restaurant and we were 5 feet apart and sitting there for more than 15 minutes, and I'd later test positive for COVID, you would get an anonymous notification later saying, hey, I was in close proximity to someone, not Dave, but someone who was likely infected with COVID-19. So it gets down to using this, this really nice balance between privacy and technology in the fight against COVID-19.
So what does it do for me? So I'm at a restaurant and I have COVIDWise. I've downloaded the app, so it's kind of like one of those walk apps or mileage IQ apps that turn on when you start moving. So I sit down. There's a guy or a gal 2 tables down, 8 feet, 6 feet, 5 feet, and 8 days later they test positive. What does that have to do with me?
I'll give you the example of me. I was one of those rare folks that actually got a notification. Okay, so Friday night, like 1:44 in the morning, I thought my kids were texting me, right? No, I get a ping. It's an exposure notification from COVIDWise, and it says you were likely exposed 4 days ago, all right? Now, I don't know if that was at my Rotary meeting. I don't know if that was at the Council of CEOs. I don't know if it was at Kroger, but I know that during the course of that day, I was closer than 6 feet and longer than 15 minutes next to someone, or my phone was next to someone who had been diagnosed with COVID. Now, I got the notification, so I wanted to know. I downloaded the app, and so the very next morning, I went to CVS. I went through the drive-thru. I got the test, and luckily, 2 days later, I'm negative. But I would rather know than sit at home for 14 days and go, you know what, I don't know, or get the virus and go, you know what, I don't know, and then for like 3, 4, 5, 10 days, I'm infecting other people. And that's one of the reasons why this app's so effective.
So what's the objective of it?
The objective of it is to slow the spread, which is something we heard 6 months ago. But ultimately, there's an Oxford study out there that says that 56% of cell phone users in an area, if they download it, you completely erase the disease. It's so effective in terms of slowing the spread and ultimately stopping the spread. It could actually wipe it out. And there have been areas where that's been effective, where people have used this sort of contact tracing application. In Virginia, we've had a lot of success. I mean, today we have almost 600,000 people that have downloaded the app in 2 months. And every day, the more people that use it, the more chance that we can stop infections. Part of the thing, that same Oxford study really basically said you don't even need to have massive numbers on this to make a difference. Literally, for every 2 people that download the app, that's 1 prevention of an infection. So just even at very, very low numbers. Right now, we're at about
how does it prevent an infection? If I'm sitting all it does is notify me, David. This is what I'm trying to understand.
Well, it notifies you sooner. Okay, so let's say that in my case, let's say that I was notified 4 days earlier, and let's say that I didn't know and I was positive. Let's say 10 days later I developed symptoms. That's 6 days I'm walking around either with my mask or without my mask, in Kroger, at Rotary, all these other things, with my family, at home, and I'm literally could have infected many, many, many more people. I meet a lot of people during the course of the day, even during the shutdown. So when you do that, multiply that by tens of thousands and hundreds of thousands of people out there that have that, then you really start making a difference. One of the things is that even with the president being diagnosed with COVID, with the governor and the first lady here being diagnosed, they meet a lot of people in the course of the day. The governor himself got a notification through COVIDWise, and that was one of the things that they were notified even earlier that they were possibly infected before the test results came back. The idea is the speed, the idea of distance, proximity, and the speed of notification helps slow this thing.
So let me ask you this. I got a question here from Jimmy in Indianapolis. Jimmy says, can you ask David this? Is it going to prevent an infection or delay it? Can we truly stop a virus? Serious question for your guest. So tackle that one, David.
It's not going to prevent anything. Here's the thing. I mean, the CDC has guidelines on how to protect yourself. If you're wearing full PPE or if you're wearing something else, and that's really not what this is about. This app doesn't put an invisible cloak around you, so you're not going to prevent anything there. But in terms of notification, so that's what it is and what it isn't. It's an exposure notification system. And one of the things about it is we know that why do people have to quarantine at home for 14 days? You can be infectious for up to 14 days, which is one of the reasons why this app generates random pins for that length of period. So in terms of helping prevent the spread of the virus, this is really what the app is about. But great question, and I appreciate it.
So if I today go to I have an iPhone, so if I go to the App Store and I download COVIDWise, right?
Yeah.
And then tonight I'm doing an event for the Pence for the campaign for the Pence Kamala Harris debate. So I'm doing an event there. Of course, I always put a mask on. I'm respectful towards others. Whether or not I believe it's effective or not is irrelevant to me, because other people do, and I'm just a respectful guy, and that's fine. So I have my mask on. So then if one of those people that maybe there'll be 100 people there, if one of those people tests positive, then I'm going to get an anonymous beep that somebody that I was in proximity to on Wednesday night tested positive.
That's how it works. You got it. I mean, that's exactly it. Part of the thing is,
and then I can take it from there. I can either, if I'm asymptomatic.
And here's the thing. Yeah, the notification is completely up to you. Okay, and here's the backside of that process. If you get a positive test, and Lord, I hope that you never do, and I really don't. But let's say that hypothetically you do. You go to CVS, you get your thing 2 days later, you get a positive result. All right, then you're going to get contacted because by law the lab and your health care provider have to provide that to VEH, right? You're going to get a call. Okay, they're going to say, hey. John, you were exposed. You got a positive test, rather, and here's your 8-digit PIN to upload. All right. So to make sure that somebody's just not like wheeling through the mall, randomly saying I've got COVID, everyone, and starting to panic, you've got a PIN. All right. You put the PIN in, you verify that, and then it anonymously notifies people that you were in contact with. If it meets those parameters. Now, here's the thing. If you were 50 feet away from someone, okay, and you were only there for a minute, like in the line at Kroger, they're not going to get a notification. It's 6 minutes, it's 15 minutes and 6 feet. The big thing there is that's what the guidelines are right now, and that's their best guess in terms of how proximity and time make a difference in your likelihood of exposure.
But But if I pass by somebody for 8 seconds, I mean, technically I could contract it, right? If they have it.
Technically, you could, but the likelihood is less. And
So
the reason being,
so
well,
if go ahead, David. I'm
well,
sorry.
you have to have some sort of parameters in the app. Part of the thing is too, if we basically said, and public has to have confidence the app's working. One of the things is that right now with the way proximity works and the way that the time works is our best guess that we can put in there. If we said, here's a notification every single time these two phones kept, with 600,000 people coming into contact with each other every single day, you would have thousands and thousands and thousands of false notifications. We don't want that, right? Because that's not suiting anybody. We don't want a giant run on CVS at the drive-thru and everybody taking a test because they don't necessarily need one, right? Mm-hmm, mm-hmm. But the thing is that if you do that, now, even with me, like I said, I got my notification. I was in proximity closer than 6 feet and more than 15 minutes. And because I took precautions, I do, like you, wear a mask when I go to Kroger, when I go to my Rotary meeting. And I was lucky enough not to be infected. But the idea is that every single day there are people loading those pins up in there and notifying people to the tune of hundreds of people a day that are getting notified. And that is reducing the time that they're infected without knowing it, and therefore making a difference. We're excited about it. I think we're going to hit 15% of cell phone users in the state very, very soon, and that's one of our first thresholds. The Oxford study says that we can prevent 6 to 8% of the total population at that point, and so we're going to keep plugging away at it. And we've got the campaign running on digital and billboards and social media and radio, like your station's there, John. So we're moving forward. And I can tell you this, we've never worked harder on a campaign in our 15-year history.
We're with David Saunders. David's the founder of Madison and Maine. That's the agency that has contracted with the Virginia government in order to deploy and get out COVIDWise. So I haven't downloaded the app. So if I go and download it today, what's my downside? Because everybody's afraid, but look, I don't. One of the things that people are concerned about is anonymity. I don't want my name on a list. I don't want people spying on me through some app. I mean, these are honest concerns that people had. Like, I went to New York for one day. I had an event. One day. I went in by the train. I went in by Amtrak, got off, went to my meeting, did my TV show at Newsmax, went back on the train, went back to Washington, right? But because I stayed in a hotel, I had to fill out a form and get my number. The New York COVID people have called me 175 times because what they wanted me to do was go to New York, quarantine for 2 weeks before I went on TV, and then go back. Well, I'm not going to do that. I'm just not going to do it. I'm not going to go there and sit in a room for 2 weeks.
Right.
So, but they have called me no less than 175 times because that's what their job is. So tell me the downside. If I go and download this app, what's my downside?
Well, here's one upside. Nobody's going to call you, okay, unless you test positive, which is extremely, extremely unlikely. Okay, so there's 50,000 folks, give or take, since August 5th that have developed or tested positive for COVID-19 in Virginia since August 5th, since the app launched. The only people that have been called are ones that tested positive that have the app. So you're not going to get called. Number two, here's the thing. Personally, I would not download the app if it tracked me and if it stored my data. Okay, I'm a privacy guy. I am 100% positive that the way that the Bluetooth Low Energy works, it doesn't know who you are. You're completely anonymous. Part of the thing is people are saying, well, hey, we'd like to target, this group, with marketing, and we'd like to do this. And we can't because we don't have any of their data. We don't know their age, their income. We don't know if they're black, white, brown, or purple. We really don't know anything about the folks in because we don't collect any data. To me, this app works like 100 others on my phone that just sits there, Okay, and it just sends out some pings every once in a while. It's not even as sophisticated as the one for like Maps, which tracks your data, or Facebook, which tracks your location. For example, you go into a restaurant, it says, "Hey, would you like this restaurant?" It doesn't even work that way. Really, it's basically like having a couple of walkie-talkies turned on that can tell time and distance. The technology, like I said, has been around for over 30 years. But I don't really see any potential downsides to this. The only thing is here, some people want to know things and some people don't. Okay, if you don't want to know, okay, don't get the app. If you'd like to know if you were in contact with someone who was asymptomatic, for example,
I mean, there's no downside. I mean, I got to be honest with you because I'm skeptical, but I'm going to probably download it today because there's no downside. I mean, I kind of get the whole app thing, but there's so many apps I've got that can track my every move. Like, let me give you the perfect example. I have an app called Mile IQ, right? Very simple app because I don't write my mileage down. Like, I forget. I don't have time. Do my thing. I got to have my mileage. So, and then at the end of the month, you can code it, personal, travel, business, right? You code it. It's really neat. But it tracks your every move. As soon as the car starts up and you go, it's tracking and it'll give you the address. You started here, you ended there, right? And it's tracking my every single move. And I pay for that app because it's convenient for me to do my mileage. So if anybody wanted to know my exact whereabouts via vehicle, and the other thing I found, it also does a train. So if I take Amtrak from Norfolk to Washington, it's got that there. It's got the Amtrak station A to Amtrak station B. I kid you not. So I'm already being tracked like a wounded animal from my own device that I pay for.
Yeah. Well, one of the things about it,
I don't really have a downside here. If I get a ping and said you were exposed, I can decide whether to take a test or not. I probably would go take a test just because I don't want to expose my family. I don't know what the downside is.
Well, the app, the other thing about it is the app's free on Google Play and Apple. We're not charging you. The Commonwealth of Virginia paid for the development of the app. Google and Apple developed the framework together as a gift to public health authorities. It doesn't track you, and it doesn't cost a dime. You can go to either store, you can get it. The ratings are high on Google Play and Apple. People are happy that they have it. One thing I saw the other day I thought was pretty funny in an article I read. The guy was like, well, I have it, but gosh, I haven't gotten any notifications. Well, that's actually a good thing. I mean, you haven't been exposed to COVID. I'm like, well, it's
that's
basically,
funny, David.
He's like, hey, it just sits there. It doesn't do anything. Yeah, that's the point.
That's funny. Okay, that's funny.
So I'm like, hey, man, you it is a little disconcerting to get one at 1:44 a.m.
Yeah, I hear you.
But hey,
but you can make your own decision. That's the thing. If
here's
the
other thing about it. I'll leave you there with this, John. It's your decision if you want to get it or not. Okay. Once you get it, it's your decision to turn Bluetooth on or not. If you are possibly infected, it's your decision to upload your PIN or not.
Right.
We took this and every single decision in the hands of Virginians.
All right, man. It's interesting. David, I really appreciate your time in explaining this. I really do.
Thanks, John. I really do. Love the show. Really appreciate it.
All right. Thank you, David. We'll be in touch with the other stuff, and thank you so much. John Fredericks Radio Network, David Saunders, Madison in Maine. He's the guy that's put this whole thing together for the government of Virginia. He's the founder of that ad agency, Madison in Maine. Thank you, David. John Fredericks Radio Network.